नमस्कार। अष्टांगहृदय के वाचन में आप सबका स्वागत है। सूत्रस्थान के कल हमने श्लोक नंबर 26 धी धैर्यादि आत्मादि विज्ञानम मनोदोष औषधम परम ये देखा था। ठीक है, तो इसमें हम अभी ये देख रहे हैं कि भेषज काल क्या होते हैं और इस भेषज काल में कौन कौन से चीजें हम देख सकते हैं। What is the Bheshaj Kala? The appropriate time for administrating the medicine. The part of Avastik Kala, time based on the condition and state of the patient. What is the purpose? The purpose is to maximize the therapeutic effect and minimize the side effect and harmonize with the body natural rhythms. The principle is Kala Prabhava, time itself influences the potency of the treatment. Means the drug is same, but the working potency of the drug is changes according to the time of taking of the patients of the drug. Bheshaj Kala is a Abhakt Kala. Now talking about the descriptive about Bheshaj Kala is a empty stomach before food, Abhakt Kala for the fast action, acute condition and kapha disorder. Pratah Bhakta Kala before breakfast enhances the absorption and clears the channel of the Srotasa before breakfast. Madhya Bhakta Kala during the meals for digestive disorders, ensuring mixing with the food that we may be called as a sagras. Adho Bhakta Kala after meal for Pitta disorder, hyperacidity. So Pitta for Pachana we give Adho Bhakta Kala. Ratri Bhakta Kala after dinner for disease manifesting at night or insomnia. This type of the type. Samudga Kala before food and after food, that is Avapedak type for chronic and complex condition like a Grahani, like a IBS, like prostatitis, like colitis. Sanni Bhakta Kala at irregular time, a combined dosha disorder where where the disease is aggravated. Okay, Nisha Kala at night, Pradosha Kala in evening. In evening for imbalance dosha for the time of the Pradosha Kala means evening is a Vata Kala. In that time, the Vata Pradosha Jvadi, where we can give in the Pradosha Kala. And for the rapid absorption, for working on the each and every doshas. So these are the Bheshaj Kala have given. So according to that, we can go for it. Okay. Now the next is Atmaj Guna that we have talked about. These Atmaj Guna, when we want to treat the psychological patients, the psychological patient that is a Manas Roga, where where Raja and Tamaguna is mostly increases, and because of this Raja and Tamaguna in Manas Rogaha, we are getting difficult to treat the patient. So the counseling part is very important. How the counseling part is go. So we need to understand this point. First is the Icha. Okay, Icha, Dvesha, Sukha, Dukha, Prayatna, Buddhi, Smruti, Dhruti, Ahankara, Chetana, Shraddha, Bhaya, Krodha, Lobha, Moha, mana, harsha, shoka, vairagya, astikya buddhi. So if you go deep to this point of Atmaj Gunaha, that what I am talking, every indriya is understanding any knowledge. Every indriya, like eyes, tongue, nose, ear. Let's consider that the eyes want to see some object. If the eyes want to see some object, if the eyes want to understand what is the color of that object, the every indriya should have desire to see that object. That is ichha. Without ichha, without the prayatna, no organ, if it is a mana, if it is a indriya, if it is a karmanendriya, they don't get the knowledge. So the icha is the first part to understanding the jnanam. The same part, when the psychological patient is getting disturbed, first of all, he getting away from the icha. He don't have the desire to understand the knowledge. He don't have the desire. Absolutely don't have. He want to get away from that part. If something is happen in his life, something, and he always getting a fear that that will happen to me, that will the year hoga, that will be happen. Okay, so he always having the fear of that part. So he is unable to get face with that part. But these are the tamaguna. Tamaguna create fear. Tamaguna get fear. Tamaguna depresses the sattva. So the Sattvavajay Chikitsa in Manas Roga, where Sattvic Guna, that is counseling, creating the icha, creating the desire to understand a particular part, go beyond that part. What was the reason is behind that part, that you have to understand in the icha. What exactly happened with his life? Why this is happened with his life? Which are the parts, which are the things he making wrong, or he can be a good in that, he can be a better. So that's the counseling of icha. You have to go through it. Second is dvesha. If suppose the eye want to see that part, if your eyes, if your tongue want to eat a particular food, your tongue and your taste buds and your taste buds should have the desire to take that food, to take the chewing, should have the desire. Okay, but whenever it come a desire, the jnanam cannot be always be a good. Jnan can be a jnanam. Jnan can be an ajnanam, where you don't know anything about that particular thing. That is ajnan. Sometimes jnan is behind the ajnanam. So to understand the jnana, you have to understand ajnana. Means it is just like a four options of the question. If you don't know the answer, you go with the three options, that yeah, this may be not, this may be not, this may be not. It means this can be. So the dvesha means understanding the, like a tikta rasaha. Tikta rasa is very, very annoying rasaha. You never ever want to take a test of that tikta rasa. Okay, so dvesha should also, every indriya should understand the dvesha, icha and dvesha. These are the two opposite point. Should every indriya should know. And in psychological disorder also, many psychological patients have a dvesha about any particular part. Because of that dvesha, he might be have a dvesha of any person, anything. Because of that, the we must understand why the dvesha, why he's annoying, why he annoying, or why the person is so annoying of particular thing. Okay, after that, whenever we see the patient in clinical practice, when we talk with the patient, we can understand, yeah, after talking about this topic, the patient feeling better, patient is agree with our point. At some time when we're talking with about a different point, patient said, no, I am not agree with this point. Patient getting annoying with that the things. These are the things in clinical practice we regularly basisly we see, that some point patient get agree and some point patient doesn't. Okay, so in that part also, when any indriya try to getting jnana about something, the indriya first must have the icha. Along with indriya also don't have the icha, dvesha. These 2 points after aggravating about that object, and when the patient getting that point after having icha, and after getting that things, patient feel better, patient feel sukha, patient feel sukha. Do you understand sukha? Sukha means a happiness feeling after getting that things, happiness feeling after getting that things in your life. Means when you, when a patient, any indriya like a tongue is getting the taste of the madhura rasa, the feeling in the hypothalamus, the feeling in the emotional centers, like a thalamus in third ventricle. In third ventricle, these all are the third ventricle, fourth ventricle, and amygdala. These are the emotional centers where every desire, every dvesha is getting understood. Why the, why the indriya having that desire, and according to that, if the madhura rasa is on the tongue, then the more secretion is secreted from the tongue. According to that, the reaction from the emotional centers of a sukha, of a happiness, of a smile is created from the motor reflexes from the brain to the taste buds. This is the process of, but many times what happen, the patient's psychological condition with the tamoguna is so much that even if he having an ice cream in his mouth, he is in a psychological state of mind, he even don't understand to react, because the sukha is overhided by dukkha, by his psychological thoughts, negative psychological thoughts. What I am trying to say, that I will give one case. Look, a person is having in a good condition, having earning very good, okay, because of some psychological or something, he has a disturbance or he has a fight with his wife, by the salary. The wife has a good salary and he has little bit of less salary, and because of that he going ahead and change his job. He's actually working in a good condition, having a good salary, but slightly little bit 1 to 2 thousand, a little bit less than his wife, and he changed the job. He changed the job. He got a good salary. But since 15 to 20 years he working in a particular field, and suddenly he changing the field, changing the, and as per his age also, after getting that job he trying to understand that job, but he is unable to get the result. He's working very hard, 3 months, 6 months, more than a year, but he got a pressure, and he got to know that I can't make it. I have made a very big mistake. Now he even not going to his first job, and now if he is working in the current job, he feel very upset, because the juniors who are working under his, they are also starting laughing and blaming on him. So he become very depressed. So he form a very much negative thoughts. What I have done, I have very much EMIs and bank loans. Now what to do and what to not, and the suicidal conditions, fear again comes into his mind continuously. So in this type of patient, you must know what are the desire. The desire, what he wants is to change the job, to get a new job, to get a new salary. But why the desire he required? Why the hetu? So as a Ayurvedic physician, you should go through the deep. Why he want that desire? If he had a good job, having a good life, so by talking and counseling, then he reveal why he left the job. At first, he might be given you a very different reason, but that should you feel that should be a valid reason. By getting a job, he feel the sukha. Yeah, I got the job. I got the new salary. I got new package. He got a sukha. As soon as he going through that job, as soon as he going through that job, he understand that this field is not belong to him. He's getting very irritated. He getting very slow. He not getting to get a good result. So he become a upset. The second part come is dukkha. Second part come is dukkha. Why I did this job? Why I take that this job? This is called dukkha. So this dukkha, again the emotional secretions from the emotional center like amalgada, ventricles. Okay, the happiness secretion is dopamine. Okay, and the soreness secretion like acetylcholine. These are the secretions absolutely coming into the brain when you have a happiness, when you have a depression. So body try to get out of this situation continuously. First of all, mind, the tamaguna along with the rajaguna, talk with the mind. Why I did this? Why I want this? I want to get out of this. So the tamaguna along with the rajaguna, first of all, talking with the body is happening. The patient always kept talking with him, murmuring with him, and he got to know that I need to do the prayatna. So he did prayatna to getting out of this. He tried to find new jobs. He tried to find, or he tried to getting improve in his current job, but he unable. The same thing happened in Indriya also. Indriya, when the Madhur Rasa got on the tongue, the patient feeling very happiness. Yeah, Samupdeshan is the part, but how the samupdeshan step by step is happen in this way. So the prayatna should be has to be done with the help of a sattva guna. That you should tell the patient to write what exactly happened, what are the do's, what are the don'ts. If you are keeping working in this job, what will further happen? Write it down. And if you left this job, what will further happen? Write it down. Then patient told me, now the condition is that I can't further move with this job. I want to left this job. If I left this job, I didn't get any job. But because of this reason that I didn't get any job, I should continue this job that will hamper my life, hamper my mind, and I can't. He even don't get a very proper sleep. Since a 15 to 20 days, this fellow is not slept properly, not sleep properly. The black circle against his eyes is completely weak. His appetite is very bad because of getting not proper sleep. So when he write it down, he will understand, yeah, if I left this job, I got the satisfaction that, yeah, now I am out of this situation, but I didn't get the job, any job. I have to find the job. So by going Sattva Vajay Chikitsa, let's be a very, very transparent. Paradarshakta. The transparency, paradarshakta is the way to treat the patient. Always be transparent with every good cause. I told that patient, go your prior company, talk with your manager, then what exactly happened and why you did this situation. Tell exact truth. He did this thing. He talked with his manager and he told that I have a dispute with my wife. I have an egoistic problem against his salary. Because of my ego, I left the job, which I have working for 15 to 18 years. So I'm sorry. I want to come back. Company CEO understand his things and give his reply after 3 days that you can come back to our company, but you will get whatever the salary you have, and you didn't get any increment in for 1 year. He is happy. He is absolutely happy. Now he resigned from that job, the current job. Now, after resigning from that job, again feeling the happiness. Means he got the buddhi, he got the new ideas which were get embodied. Now he is absolutely free. I have resigned. Now I have a three months window period. After 3 months, I can go back my prior job. So he was intellectual ideas. Now the 3 months, what to do in these 3 months? So he tried to cover up all his pending jobs with new ideas. That ideas he don't get in prior state, but he's in mind. He's getting very much free by Sattva Vajay Chikitsa. So what Buddhi told him? The Buddhi told him that why Buddhi give the direction? Why Buddhi give the ideas? Because he's become very transparent. Sattva Vajay means transparent. Always be with the truth. Always go with the truth. That is the Sattva Vajay. Whatsoever the condition, never ever back the wrong deeds. That is a Sattva Vajay Chikitsa. Always on a good path. Even the path is very long, even the path didn't give any benefit, but then also always be on a right path. The right path give you satisfaction. The right path give you sukha, sometimes dukkha, because of the hard work. And after that, you will get the ideas to work on that part, that is buddhi. Now, buddhi, along with his experience, start working that in these 3 months. Whatever the pending job, he has kept that pending because he has no confidence to do that job. By of suddenly buddhi is working, his experience of the before job, he got the dhruti, smruti and dhruti. Because of this smruti and the dhruti dharana, he start working on that pending job. And what is it? What a miracle! The pending job getting work on. Those employee who are laughing on him, they again started respected him. Yeah, boss is working. Boss, what happened to the boss? Yeah, this boss since 1 year absolutely is a baseless, useless person, now started working and getting result and getting getting uh, cure every file. Now the work burden now on the employee. Every time when the employee is coming with the file, he told him that go and again check, go and again check. 3 to 4 times he told that every employee to check that file because he don't know that field, no. So he know that my employee know the better. So he working from that, taking the work completed from the employee for 2 to 3 times, and that makes the work is perfect. That is the technique. That is, and behind the mind he has some ahankar also, that these people are the people who laugh on me. So when I left this job, I will punish them or something. That this is the ahankara, ego, self identity. What happened in 3 months? Every work is going. The super boss from the new company meet with the my client and tell, why are you left, why are you resigned, you are working very good, don't resign. Now 3 months before, he has a condition to suicide, and now after just the paradarshakta of sattva vajay chikitsa, he feel, I have now two job, my new company again offering me a new job by my work of this 3 month. So the center of satisfaction with the Chetana Guna, he start believing on himself. That is Shraddha. The believing on yourself, believing on yourself. That is a Shraddha. Believing on yourself and removing the fear from your mind. That is a Sattva Vajay Chikitsa. Always be a Paradarsha. If a person making a bad thing, he is always in a state of fear. If the person is open mind, is agreed to that, yeah, I did a bad things, I am agree, and I will told with my colleague, with my family, that I have did this, I'm sorry, and I want to move it from it. So that's things to become a paradarshak, make belief on yourself and remove the bhaya, and sometimes krodha also. Why the people do the wrong things? Why people do the wrong things? What do you think? Why people go with the wrong path? Even from the start, even from the birth, their education is very good. Their parental education also good. Their parents have taught them a very good culture. But on the path of the journey in their life, sometimes people take a wrong way. Why? People go with the wrong path. Why? Because The lobha, lobha of anything, lobha of about any vyakti, lobha about money, dravya. This lobha creating the rajaguna, this moha creating rajaguna. This happens in indriya also. Yeah, diabetic patient don't want to eat madhur rasa, but still the moha, lobha, harsha try to attract the madhur rasa, and at one point his ahankar told to the buddhi that once in a while in a madhur rasa not affected his body, go take that the part. It's not the it's not about the indriya, it's about your rajaguna is overtaking the sattva. That's called pradnya paradha. When the pradnya paradha aparadha, when the pradnya aparadha happen, pradnya aparadha happen only when you are on the path of a rajaguna and your sattva guna is getting less and rajaguna overtaking your sattva guna. Why this happen? This happen because rajaguna give you the lobha, moha, harsha, and sometimes bhaya. So these are the tactics of rajaguna who taking you from sattva guna to rajaguna path. And after this thing happen, after this thing happens means if you find 1 lakh rupees on the path, no one is there. If you find a gold chain in a path, no one is there. You got a lobha, you got a moha, you got a arsha. You will feel that, oh, if I get that things, I will, I shall pay my debits, I shall pay my expenses. Okay, so these are the rajagunatmak guna, and slowly rajagun along with the tamagun is getting triggered. Yes, you should take that money. Come on. Now tamaguna get the tactics. Yeah, is anyone is there? Should I hide that money by my handkerchief? This prayatna of tamaguna along with the rajaguna to take the mind to the bad path is all the tactics of the raja and tamaguna. In that time, close the eyes. In that time, close the eyes. Think about your sattva guna, means vairagyata, astikya, conviction of a truth, and vairagyata. To find the sattva guna in your mind, just close your eyes and feel that if this money is of yours and if you lost this money at somewhere, in the world, you trying to find your this 1 lakh rupees where I lost it. So whatever you are taking that money is not of yours. Someone is trying to find that money. Someone is trying to find that gold, and you are taking that money in your hand. You are taking that gold in your hand that was not yours. When you closing your eyes, think about your teaching, think about your parental teaching. You will get to know. Always do a good work, hard work. Always do prayatna, always do kashta, and always have a kashtatmak money, hard work money. If a penny of a hard work money is also that will give you a satisfaction. And on that part, If you take that money and go to the police station, or if you ask to someone that is there anyone who is finding something here, or if you take that money to the police station and you give that 1 kg 2 kg gold or something, 1 lakh 2 lakh rupees, you feel a moral satisfaction that is called vairagyata. Vairagyata means the detachment from the raja and tamaguna is called vairagyata. When that person left his job and trying to left the job, he's working with the sattva guna. He's getting clear all the files. The super boss coming to him, clapping on his back, and take good words. Which super boss is blaming to him to not working properly now is praising him. And what leads? He again increment his job, but now he resigned. He resigned. But again the opportunity come to the earlier company with again a good job because of the sattva vajaya chikissa. When you have a vairagyata from the raja and tamaguna, you feel a complete satisfaction. So the for sattva vajaya chikissa, the main part is paradarshakta. Always be a truthful. You will fear that if I go with this path, this will happen, that will be very tremendous. I got ashamed of myself of doing this thing. Don't worry. Everyone in his life going through this path, everyone. But no one will be very paradarshak, transparent with his truth. So always be a truthful. When you when you betrayed someone behind his when you betray, try to tell truth to that person. He will angry, but after some time, time has to pass. After some times, he will again have a faith on you. Shama, Shama is the main thing. You should have a you should also have a capacity to shama someone. So astikya buddhi is the shama, is the conviction divine. साइकोलॉजिकल में भी साइकोलॉजिकल डिसऑर्डर्स में भी बहुत बार ऐसा होता है बिकॉज ऑफ अहंकारा द पर्सन इज नॉट लेटिंग डाउन since the 15, 20 years he not able to contact that person, not able to talk that person because his ahankara, his raja and his tamaguna trying to avoid to doing these things. What will happen if he says sorry? Nothing will happen, but he will feel satisfied. Tell to that person that I am sorry. Since a longer time I am fighting with you against what I feel that you are against my principle. But now I feel ashamed. That's a lots of year I waste my time, my whole year just for fighting with you. I am sorry. If it is a dispute of a land, if you're a dispute of a thoughts, if you're a dispute of a relation, just say sorry. By talking the sorry, it feel vairagyata. You are away from raja and tamaguna, you will feel sattva vajay. The lightness in your body is very, very much that you will feel absolutely vairagyata. Out of the world feeling जो रहती है. So this feeling always be in your life, in every path of the life. Always be a truthful. Whatsoever condition, always be a truthful. You will never ever find in a in a in a bad state of mind. It will always be opportunistic state of mind. A transparent thoughts path always create the opportunity. A sattva vajay path always creating a good opportunity. Sattva vajay thoughts creating the sattva vajay opportunity that attracts the sattva guna. Rajagunatmak thoughts attract the rajaguna. Tamagunatmak thoughts attract the more and more tamaguna. So, friends, today about this Atmajguna, I'm trying to tell you, or try to tell you, how the psychological treatment should go. On these 20 points, you can treat any psychological disorders. Just you have to think on this point, work on this point, and consult this patient with all this point. Okay, I hope uh, I told you more about this. And you should think about this only. So tomorrow we will think on the next sutra. Till then, thank you very much. Good day to today. Dhanyavad. Adhyatma Nadi is completely different. Is completely different. Adhyatma Nadi means you should have a sattva guna. Sattva guna, see the sattva guna. Sattva guna can differentiate the raja and tamaguna. Sattva guna can differentiate the raja and tamaguna. A clear water, when a clear transparent water, when you add some dirtful things, you can easily differentiate. But the dirt water, and you again adding 1 to 2 drop of dirt, you cannot differentiate where that dirt going. So to see the raja and tamaguna of other patient in a nadi, you should be a very sattvic. In Atvaj nadi, when you see the raja and tamagunatmak part, you should also having very sattva vajay chikitsa, sattva guna, full of sattva guna. Then only you can understand the raja and tamaguna. But you are fooling with the lobha, krodha, moha, irsha, then you never ever get to see that raja and tamaguna. You will see only in your body's raja and tamaguna, in his nadi. So Adhyatmic nadi need calmness, very calmness. Always think that you need to study more, you need to have more jnanam. I am with a full of adnyanam, that the feeling making you calm, that you don't know anything. That feeling is more opportunistic, opportunities to learn. Can we change the Atmaj Guna? Will they change as they are by birth? No. Atmaj Guna are in particular state of mind, it's always with a Raja and Tamaguna. Always with a Raja and Tamaguna. You can remove that Raja and Tamaguna and have a Sattva Vajay Chikitsa. Yes, you can change his behavior. You can change his behavior. But yes, jap of mantra comes through Devavya Prashaya or Sattva Vijay. Look, any mantra, any jap is work on your Sapta Chakra. It's working on your Sapta Chakra. How they are working on Sapta Chakra is a different part. Any word, any mantra which you are chanting for 10,000, 1,000, many avartana, that will stimulate your chakra, Muladhar, Swadhisthana, Manipur, Anahat, Vishuddha, Ajna, Brahmarandra. So this work on your chakra by taking avartana. This is called nadi shuddhi, sapta shuddhi, sapta chakra shuddhi. That is also one of the way of clearing your raja and tamaguna. In that you have to avoid the tamagunatmak ahara also. So this is another way of to removing that part also. Okay, so let's stop here. Thank you very much. Tomorrow we will talk on the next topic, and if you have any questions on this topic, you will talk on the group, on WhatsApp group. Okay.